All right, hey partners. This is Frank. My pronouns are he and him. I'm your LACCAL co-chair for the Pride Network. This is your August edition of the PrideCast, coming to you from downtown Los Angeles. And I'm here with Craig Thompson from AIDS Project Los Angeles. Hey, Craig.
Hey, I'm Craig Thompson, CEO of APLA Health. Pronouns he, him, his.
Cool. Thanks for being here today.
Absolutely.
And I'm with
Rich Leduc, also on the Pride Network board with Frank. My pronouns are he, him. And yeah, welcome to our August PrideCast.
We are enjoying a lovely iced pour over of Guatemala today, and we're drinking Guatemala. You can't see him, he's on the other side of the computer, but our friend Ken, who's been our partner with AIDS Project Los Angeles, since we started volunteering together over 8 years ago. I think that was $392,000 worth of donations since that happened, and his favorite is Latin America coffee, so we are having a lovely cup of iced Guatemala today. So take your sip, your slurp, enjoy.
It's really good.
Yeah, it's really good. It's great iced. This is perfect.
Perfect. This time of year. It's
On a day like today. Yeah.
Absolutely.
So I called out the number. I already gave away why we're meeting today, but Rich, I didn't mean to steal your thunder. But what are we talking about today?
No, it's okay. So today we're here, in case you're wondering why, we have our special guest Craig with us. This is our official kickoff conversation to AIDS Walk LA 2024. And we want to state our goal from last year in our fundraising efforts. We're proud to be one of the biggest partners to APLA Health in terms of fundraising every year. And we don't want to give that up. We want to keep that going, right, Craig?
Absolutely.
Yeah.
We want you to.
We have we're shooting to beat last year's efforts. We're trying to get to our goal of $80,000. So we're going to talk a little bit about the history behind AIDS Walk LA. I heard it's a big anniversary that we have going on at 40 years.
That's right.
40 years. What is on your mind as we approach the 40th walk, here in Los Angeles?
Right. So first of all, this was the first AIDS walk in the world. So not only is it 40th, but it's the very first. So we're very proud of that. I think in part of the legacy of that and being a part of all the people who have walked over all these years and all the progress we've made and how much of that progress has been made because of things like AIDS Walk. When we look back at the history of the epidemic, one of the challenges was that for the first number of years, we allowed the narrative to be set by other folks. And the way that LGBT folks, the way people living with HIV were portrayed was very negative. And we in the community realized we needed to seize the messaging. We needed to get our message out. And we used things like AIDS Walk to do that. And over the course of that first 10 years or so, attitudes of Americans around LGBT folks, around queer folks, around people with HIV changed drastically because we introduced them to who the real people were that were affected. And we found through AIDS Walk that there were a lot of folks who said, this is not my key issue, but these people need help, and I'm willing to help, and I want to help. Give me a way to help, and that was called AIDS Walk.
We've seen many advancements in HIV and AIDS research.
Yep.
It's pretty incredible where we are today versus where we were in the early 80s when this became part of the conversation.
Yeah.
Why is it still important today that APLA Health raises funds?
So I think we've made tremendous progress, and it's for somebody who's worked in this field for many years. I wake up every day, acknowledging the progress we've made, but we're not to the finish line yet, and there's still important work to do. There's still disproportionately impacted communities, particularly younger gay men of color, transgender folks who are still getting infected in 2024. So we need to be working on reducing the number of new infections, getting the word out, and then we have about 50,000 people in Los Angeles County living with HIV who need our help. So these are folks that many of them are low income, many of them have chronic health conditions, including their HIV, and they need food and transportation and housing and medical care and a lot of other, support that APLA Health can provide to them. It's also important to realize that that group is part of the group of queer men who lost half of their brothers, if you will, during the HIV epidemic. So we lost about 400,000 roughly gay men to the AIDS epidemic. And those people were overrepresented in their 20s, 30s, and early 40s. So if you were in your 20s, 30s, and 40s living in Los Angeles at that time, about half of your peer group got wiped out. So you've been through the destruction, the death of half of your friends. So now here you are at 60 and you survived, but you don't have the kind of peer network that everyone else does. And you're dealing in many ways with the PTSD of being a survivor, but having lost all of those friends. So increasingly what we do is provide emotional support and care to those folks as they're aging. The great news is they're still alive. The bad news is they're alive and very isolated.
I think about like our Gen Z partners and our millennial partners and, the partners that are serving drinks every day. Like, why is it important for them to get involved and show up for AIDS Walk?
Well, I think, first of all, because we have to get the message out there that HIV is still there. Now, the amazing thing is we have wonderful tools, both to keep you from getting HIV, called PrEP and other things. And if you do get HIV, we can get you on medication, keep you on medication, and promise you basically a normal lifestyle. So that's amazing, but that doesn't come without hard work and knowledge and education. And so as much as anything for younger folks, it's not just about raising money, it's about raising awareness, and that this issue is still there, and it needs to be an issue that they take notice of and find important.
Yeah, I think that's a really good point. I think about events like this, and even on our 40th anniversary of AIDS Walk, it's honoring the past, keeping in mind what's happening now, and thinking about the future. I think my last question for you is, if we have partners or community members that are unsure of like committing to fundraising, or maybe unsure about coming to the event, or vice versa, maybe they want to fundraise and they can't make it to the event on October 13th, Sunday, mark your calendars if you haven't already, what would be your message to them?
So anything and everything you can do is helpful. So obviously getting the word out, talking to people, and participating, either coming to the walk and or fundraising. I think what's important for people, is that this is AIDS Walk and actually HIV now is a part of a larger discussion around health equity and equity in this country. When we look at who's disproportionately impacted, it's lower income folks and communities of color. America's never been fair. I think we've acknowledged that very much, and that has played out in the AIDS epidemic. And one of the things, probably the primary thing that we work on, is trying to level those scales. And make everything equal for everybody, regardless of what community they're from. And I think we do a really good job in HIV care in that, but that's where we need your support and your help. And so to keep that scale in balance, to provide those services, and to keep the visibility there, because as we know, when problems move into lower income communities, when problems move into communities of color, they somehow disappear off of the media's radar, off of politicians' radar. So we have to keep that visibility. We have to keep that momentum.
Absolutely. Thank you.
If I'm a Starbucks partner that, we're talking about here, who's thinking about signing up, I might want to know, where exactly is the money going that I'm going to be fundraising, or by signing up, right? So where is the money going to go that's being fundraised this year for AIDS Walk?
So I would say the majority of it, I don't have to tell people here, how expensive it is to live in Los Angeles. And I think a lot of the AIDS Walk money is going to provide basic support to people living with HIV. So these are mostly lower income folks living on under, say, $16,000 a year, which is a huge struggle. And so our Necessities of Life food bank program, which provides 100% of the groceries that they need for a week. That program is very heavily utilized by older people living with HIV who literally wouldn't eat without that, or would have to choose between making rent or paying their phone bill and eating. We also provide rental assistance and helping people finding and keeping their housing. And we know, people with HIV have an illness that makes them particularly vulnerable to homelessness. And we know that once people start that slide from sleeping on a friend's couch to sleeping in their car to ending up being homeless, it's very hard to get them stabilized and back into housing. So we work very heavily on keeping people stable in the housing that they have, with shallow grants and support, case managers and other folks. So food, transportation, housing, really basic services that keep people alive and healthy.
Thank you, Craig. That's really, really helpful.
Fundraising is going on now. AIDS Walk Sunday, October 13th. We are going to really push it starting the second week in August all the way up until the event in October. Sign up first. Sign up to fundraise. Our team page is live now. Get your name on the list. I think about last year, we held our title as the #1 fundraiser. I think that's 3 years in a row, 3 or 4, 5. Well, we're going to make it 5. So our LACCAL goal is $80,000 this year. And we have cool company benefits that can help you get there. And so as you sign up to walk, also sign up on the Benevity or the Community Champion portal to get your hours tracked. That all goes into our total contribution, as well as every dollar that you choose to donate through the Community Champion portal into AIDS Walk is matched with our matching programs. We have really cool programs to make our dollars go further and make our Starbucks dollars go further. I'm really excited about this event. We have partners in the last couple of years come all the way from like our northern stretches of like Fresno and Visalia. So we're super excited that this is one of our largest events of the year from partners show up, and yeah, I can't wait. It'll be super fun. Thank you.
Thank you, and thank you so much for everything you've done all these years, and look forward to seeing you in October.
All right. Gonna make it a great year. Thank you. Thanks, partners.